For generations, men have been bombarded with falsehoods about masturbation, that it weakens your body, diminishes your manhood, or is a youthful habit you're supposed to abandon as you age. These myths don't just spark embarrassment, they can silently erode your physical health, emotional well-being, and self-confidence, especially as you navigate life after 60. I'm Dr. James Carter, a urologist and men's health specialist with over 30 years of experience helping men in their 60s, 70s, and beyond rediscover their vitality and embrace their health without shame. In this video, I'll dismantle 6 pervasive myths about masturbation that are quietly undermining older men's well-being, grounding every point in science to replace fear with clarity. Stick with me, because in just a few minutes, I'll reveal a deeply rooted myth that might explain changes in your bedroom performance, even if your hormones are perfectly balanced. If you're a man over 60 who values staying informed, confident, and in control of your health, hit that subscribe button and turn on the bell to never miss content designed specifically for you. In the comments, type 1 if this topic resonates, or 0 if there's another health concern you'd like me to address. Let's break the silence, challenge these myths, and empower you to live fully, confidently, and unapologetically at any age. Myth 1. Masturbation lowers testosterone. One of the most persistent myths is that masturbation drains your testosterone, leaving you less masculine, less energized, or physically weaker. I've had countless patients, men in their late 60s or 70s, sit in my office visibly nervous, whispering, "Doc, is this why I'm so tired or less driven?" They fear a private, natural act is robbing them of their strength. Let's set the record straight. There's no scientific evidence that masturbation lowers testosterone levels long-term. Studies show that sexual arousal temporarily boosts testosterone, which then returns to your baseline after orgasm. Your body is a finely tuned system, and masturbation doesn't disrupt its hormonal balance. The real harm lies in the psychological toll of this myth. Guilt and fear can lead men to avoid masturbation, creating stress that saps energy and confidence more than the act itself. I worked with John, a 68-year-old retired teacher, who stopped masturbating for years, convinced it caused his fatigue. After testing, we discovered his low energy was due to untreated sleep apnea, not his habits. To support testosterone naturally, prioritize 7-8 hours of sleep, regular strength training, and a diet rich in zinc. Think nuts and seafood, and vitamin D from sunlight or supplements. If you're concerned about low testosterone, a blood test is the gold standard. Don't blame masturbation based on outdated myths. Releasing this fear can restore your peace of mind and help you trust your body's natural rhythms. Let's move to the next myth, which hits even closer to home for many men. Myth 2. Masturbation causes erectile dysfunction. A common worry among men over 60 is that masturbation leads to erectile dysfunction, ED. I've seen patients hesitate, then ask, "Is this why I'm struggling to perform?" Their voices carry shame, as if a lifelong habit has broken something essential. The truth is clear: masturbation does not cause ED. In fact, achieving an erection during masturbation is a powerful sign that your blood vessels, nerves, and hormones are functioning. If you can get an erection alone but struggle with a partner, the issue is often psychological stress, performance anxiety, or relationship dynamics, not physical damage from masturbation. There's an important nuance, though. Excessive consumption of high-intensity pornography can rewire your brain to crave specific, unrealistic stimuli, making real-life intimacy less arousing. This isn't masturbation's fault, but the environment around it. Robert, a 72-year-old patient, regained confidence by reducing porn use and practicing slower, more mindful self-stimulation, which rekindled his connection with his partner. To support erectile health, try pelvic floor exercises, Kegels, to improve blood flow. Contract your pelvic muscles for 5 seconds, 10-15 times daily. Address lifestyle factors like smoking, high cholesterol, or stress, which are common ED contributors. If issues persist, consult a urologist to explore causes like diabetes, hypertension, or medications, for example, blood pressure drugs. Masturbation is a tool to understand your body's capabilities, not a cause of dysfunction. Use it to build confidence, not fear. Myth 3. It's immoral or shameful at your age. Perhaps the most painful myth is the belief that masturbation is sinful, weak, or inappropriate as you age. I've spoken with men in their 60s, 70s, and 80s who carry deep, quiet guilt about a private act shaped by cultural, religious, or familial messages labeling it as childish or wrong. Michael, a 75-year-old widower, shared how he felt dirty masturbating after losing his wife of 50 years, even though it helped him cope with loneliness and grief. Another patient, a 70-year-old devout man, avoided masturbation for decades, believing it violated his values, only to find it left him emotionally disconnected. This guilt is heartbreaking and unnecessary. Your desire doesn't retire at 60, 70, or beyond. It's a fundamental part of being human. Masturbation can be a healthy form of self-care, offering stress relief, emotional comfort, or a sense of connection, especially for those navigating loss or reduced partnered intimacy. It's not a betrayal of your values or a sign of weakness. Guilt, however, can fuel anxiety, depression, or emotional isolation, which harm you far more than the act itself. To release this burden, try journaling your feelings to process them, or confide in a trusted friend, partner, or therapist. If your beliefs conflict with your desires, explore resources like faith-based counseling to find peace. Your needs are valid, and embracing them without shame is a powerful step toward emotional and physical health at any age. Myth 4. It reduces interest in your partner. Men in long-term relationships often fear that masturbation signals disinterest in their partner or even betrayal. I've heard husbands married for 40 or 50 years ask, "Am I hurting my marriage by doing this?" The worry is especially acute when intimacy slows due to aging, health challenges, or differing libidos. The truth? Masturbation doesn't mean you love your partner less or are unfaithful. It's a sign you're still connected to your vitality, which can support, not undermine, your relationship. As we age, intimacy evolves. Partners may face menopause, chronic illness, fatigue, or emotional shifts, reducing sexual frequency. Masturbation can relieve pressure, allowing both partners to explore closeness in new ways through emotional conversations, non-sexual touch like cuddling, or shared activities like cooking or walking. A couple in their late 60s I worked with found that discussing masturbation openly led to playful, honest talks about their desires, revitalizing their bond. Another patient, a 65-year-old husband, used masturbation to manage his higher libido, which reduced tension with his wife and fostered deeper emotional intimacy. To strengthen your relationship, try scheduling connection time with your partner, whether it's a date night or a heartfelt talk. Communicate openly about your needs without judgment. Silence and assumptions create distance, not the act itself. Masturbation can be a bridge to balance and trust in your relationship. Myth 5. It decreases sensitivity over time. Many older men notice reduced sensation during intimacy and fear masturbation has permanently dulled their nerves. Patients say, "It takes longer now," or "I don't feel as much," blaming their habits. This can feel discouraging, especially alongside age-related insecurities about performance. The reality? Your body isn't broken. It's adapted to repetitive patterns. Using the same technique, like a firm grip, rapid motion, or high-pressure stimulation, trains your brain and nerves to expect that specific input, making other touch, like a partner's, feel less intense. This isn't permanent damage, and sensitivity can improve with intentional changes. Experiment with lighter touches, slower pacing, or lubricant to reduce friction and enhance sensation. David, a 70-year-old patient, regained sensitivity by varying his approach and focusing on relaxation rather than rushing to climax, which also boosted his confidence with his partner. Aging naturally affects blood flow, nerve responsiveness, and testosterone levels, but lifestyle changes can help. Regular cardio, like brisk walking 30 minutes daily, stress reduction through meditation, and a diet rich in antioxidants, berries, leafy greens. Emotional factors like performance anxiety or self-criticism also dull pleasure. Practice mindfulness during masturbation, focusing on the moment rather than the outcome. Keep a journal to track what feels good and adjust accordingly. Your nervous system is resilient. Even in your 70s or 80s, approach it with curiosity, not blame. Myth 6. It's harmful if done too often. The question, how much is too much, haunts many men who fear frequent masturbation signals a loss of control or health risks. This worry often carries judgment, as if a number defines your well-being. The truth? For most men in their 60s, 70s, or beyond, masturbation isn't harmful whether it's daily, weekly, or less frequent. I've seen patients thrive with regular masturbation, feeling energized and emotionally balanced, while others carry guilt despite doing it rarely. The difference isn't frequency but balance and intent. If masturbation disrupts work, relationships, or hobbies, it might reflect compulsive behavior or avoidance of deeper issues like stress, loneliness, or unresolved grief. Conversely, it can be a powerful health tool. For some patients with chronic pelvic pain or insomnia, gentle masturbation reduces tension, improves blood flow, and promotes restful sleep. Tom, a 66-year-old patient, found that occasional masturbation eased his restless nights, boosting his mood and focus. Another patient, a 78-year-old retiree, used it to manage testicular discomfort after prostate surgery with positive results. To assess your habits, reflect. Does this enhance your life or mask unaddressed emotions? Journal your feelings for a week, noting how masturbation fits into your routine. If it feels out of balance, talk to a therapist or trusted confidant. Build a fulfilling life with social connections, hobbies, and exercise, like yoga or swimming, to ensure masturbation complements, not dominates, your well-being. It's about empowerment, not restriction. Conclusion. Thank you for having the courage to engage with this sensitive, often taboo topic. We've debunked 6 myths. Masturbation doesn't lower testosterone, cause ED, or make you immoral. It doesn't harm relationships, permanently reduce sensitivity, or become dangerous with frequency. These myths chip away at your confidence, but you can reclaim your health, vitality, and peace of mind. Aging doesn't erase your right to feel alive, connected, or human. You're not just older, you're wiser, with a lifetime of resilience behind you. You've built a life of strength-raising families, overcoming challenges, and growing into the man you are today. Now, extend that care to yourself. Whether you choose to masturbate or not, let your decision come from knowledge, not shame. Take one small step today. Schedule a doctor's visit to check your health. Have an open conversation with your partner, or write down one thing you appreciate about your body. These actions honor your mind, body, and emotions, which deserve respect at every age. If this video shifted your perspective or lifted a burden, please like, share, and comment below. Type 1 if it resonated, or suggest another topic to keep this conversation alive. Your story matters, and sharing it might inspire another man to release guilt and embrace his vitality. Stay informed, stay confident, and know it's never too late to live fully as the man you are today.